an answer for a question which has already been searched. Therefore, you are researching. Now, there are certain important points you need to keep in mind when you ask a research question. Hundreds of thoughts come into your mind, but not every thought that comes into your mind automatically translates into an adaptable, clinically adaptable and provable research question. Now, what do I mean by that? Supposing you have a feeling that intraocular pressure when measured on the moon will be 0. That thought comes. Can you translate it? It's not possible. So remember, every question that comes into your mind does not necessarily translate into research. But all humans at all time, should have passion for adoption of truth. And nothing but truth. That is number one. Rejection of falsehood and adoption. That is basically what you are doing in research, that you want to find out the truth. And if you realize that it is not the truth, you want to reject it. That is rejection of falsehood. But remember, this is not a static process. It's a dynamic process and a continuous process where what you thought was truth is no longer truth. It becomes different. So it keeps changing. So don't stick to a truth described 15,000 years ago as truth. But you analyze. That's how we want to do research. So this was written way back in Yajurveda. I'm quoting from Yajurveda what they have said. This is the most wonderful statement they have made about research. You will be surprised to know that this was made long time ago, which holds true even today. Now, why research at all? Then you will be using castor oil for cataract, otherwise, or bloodletting for diabetes. So research is a way of improving your life expectancy, your comfort in life, etc., etc. So therefore research is important. Now, how do you frame a research question? Now, in order to frame research question, there are a few things you need to know. What is the subject of your research question? And you need to know everything about that. Otherwise, they will be just hitting here and there and here and there and trying to find an answer. You must be very focused in your question. Does a capsulotomy cause an alteration in the refractive error following capsulotomy in a pseudophakic eye? You see how the research question becomes longer and longer and more specific. Does a capsulotomy alter the refractive error? When you ask, then number of parameters should be included in that. Asotherwise, it becomes meaningless. Because what you are looking for is after capsulotomy, I am doing refraction, I am taking corneal astigmatism, which doesn't change presumably after capsulotomy, and I am checking refraction to see if refractive error changes. So your research question becomes longer and longer. If you take out American Journal of Ophthalmology 20 years ago and now take out the same AJO now and look at the title and question in the article, it has become very long and very detailed, unlike olden days. Or 20 years ago, 25 years ago. When I was doing post-graduation, there used to be a small title for some articles. But now you no longer find such title will be very long. Because in the title, what I want to research and what I am likely to do in research, everything will be described. Okay? You have to have funds. Because you need to decide what type of research I am doing. What type of research I am doing depends on what is my question. Research, without knowing the research question, you cannot decide what type. And without knowing what type of research, whether it's clinical research, experimental research, what type of research I am doing, I don't know. But I want funds for research. What funds you want? How much fund do you want? You don't know. Unless you know your question, your answers for every other question is nil. You understand what I am saying? So therefore, it is very, very important to frame your research question properly. So what are the prerequisites? You need to have knowledge about what you are researching and identify the lacunae in that. Then only you start researching, which means that you need to have a lot of knowledge about it before you identify the lacunae. If everything is zero, there is no lacunae at all because you know everything. So knowledge is important in identifying, and having identified the lacunae in the knowledge, what your research will do to fill that gap in the knowledge. These two decide what is the research question. So these are all very simple answers. Supposing you have a diabetic patient, it's a common clinical problem. Diabetic patients develop diabetic macular edema. Okay? Now you want to know what percentage of them develop diabetic macular edema. Then your question becomes even more specific. Do you include all diabetics? Do you include only diabetics who have had diabetes for 10 years? Do you include diabetics who have had diabetes plus who are on insulin for 10 years? Do you include post-operative diabetes, pre-operative? What type of diabetes, if you say, it doesn't mean it doesn't identify the patient as to what type of diabetes he has. You understand? So you need to be more specific. So I want to look at diabetic patients who have had diabetes for 20 years and who have fairly well-controlled diabetes. Now the question comes, how do you know that it's fairly well-controlled for 20 years? Then you need to have a record of HbA1c, you need to have a glucose record. You don't have. So how do you say fairly well-controlled? You don't know. You understand, when you ask certain questions, it becomes very difficult. But if you search literature, you get an answer. About 30 to 50% of the patients with diabetes who have diabetes for 10 years or more are likely to have diabetic macular edema. The answer is already there. Why you want to do a research? They have already given you the answer. So therefore, your question should depend not on your lacunae in knowledge, but your question should depend on the lacunae in the whole knowledge of the specialty. Not your lacunae. One may have complete lacunae and he may ask hundreds of questions for which you read, you get an answer. So therefore, before you ask question, you must read. Otherwise it is impossible. Now you want to include patients. How many patients to include in the research question? You don't know. For that, you need to have what is called as sampling, patient sampling. What is your research question decides how much sample you need. See, they are all interconnected. You cannot separate research question from sampling, from technology, how you identify the patients, etc., etc. You cannot just offhand say, "Acha, chalo bhai, ye research kar do tum." Question दे दिया, क्या question है, ढूंढ लेंगे, research करो, question बाद में ढूंढ लेते हैं. So it doesn't work like that. You need to know exactly what research you want to do. Okay. Now, diabetic macular edema. How do you identify diabetic macular edema? By doing OCT. Very good. Now, how many patients do you need for what research you are doing? That you have to find out. A statistician, they're going to talk about sampling techniques also, Jatinder. Yeah. So he will tell you how to calculate the sample number for a given problem. So diabetic macular edema problem is there. They take into consideration a number of factors like prevalence, incidence, etc. And then the statistician will tell you, sir, in this amount, you need this number of, minimum this number of patients for getting a research answer. Otherwise, without a proper sampling, it is meaningless. Your research is useless. That is one. Now you have identified post-op, pre-op, OCT needs to be done. Okay, now there is a cost involved in that. So you need to calculate, okay, a pre-op OCT for diabetics, one post-op OCT for diabetics is necessary. But how many months after cataract? That again has to be decided by you. If you do it after 1 month, there may not be any edema. If you do on one day, it may be 100% edema. So your research has no meaning. You see how complicated the whole thing becomes. What percentage of diabetic patients following uncomplicated cataract extraction with intraocular implant have diabetic macular edema on first week post-operative. Now it is more specific. You are becoming more specific. On first day post-operative, you are even more specific. On first day and on 30th day post-operative, you have even but your cost will escalate like mad. The amount of work you have to do is even more. You have to do OCT on first post-operative day, you have to identify all uncomplicated cases, then you have to do on first week, then you have to do on 30th post-operative day. Okay, that's a huge cost, plus a lot of amount of work. At the end of it, what is your question? What percentage of patients have diabetic macular edema after an uncomplicated cataract extraction with IOL? Phaco or ECCE they will ask. Phaco or small incision they will ask. You understand? Then it becomes even more complicated. So therefore, your research question should be more and more and more specific to the point. Now at the end of that, what is it that you want to prove? That many patients with diabetes develop macular edema post-operatively even after an uncomplicated SICS or phaco. That is the answer you want. You look up literature, you get an answer. So read your review of literature very carefully before your question is answered. There may be an answer. It may be wrong answer for various reasons. So you want to correct it. That is the lacunae in knowledge. You get the point. So that is why you have to do. Now, you have identified the diabetic patients with macular edema, you want to give Avastin. Government of India said, no problem, give Avastin. So you decide to give Avastin. When do you give Avastin? When you identify macular edema or later on. And how do you know that Avastin has worked? So you have to do one more OCT. Whether it is associated with improvement of vision or not, you don't know. See, so many factors are involved in your research question. Okay? So whatever is the research question you do, first thing you do is study about it. Collect as many number of papers as possible. Get the evidence level 1 paper where the best possible evidence is available. Answer is already given. You read it. You are not convinced that that is not the way it is. Then you read more about it. Search the literature. That you have to do. Without doing that, you will never know the lacunae knowledge. Once you've done all that, now you know the lacunae. Then next the question is, go to a statistician. If you don't know how to calculate the sampling number, you talk to a statistician. He will tell you, this is the incidence of this disease, this is the prevalence rate in the population. Can you tell me how many number of patients with this particular disease, with this prevalence rate and the incidence rate need to be included in the study before we do the research question. So sampling number 2. Once you get this, number 3, funding. You need to have enough funds, otherwise you will research will stop halfway through. Oh, pata nahi yaar, band ho gaya wo. You need to have enough funds. So when you put all of them together, then only you can frame a research question. Otherwise you will be wasting time. Sampling number of research to identify the lacunae in knowledge, number 1. That is read and read. From where? Read all the papers that is available. PubMed gives you so many papers free, no problem. Read through them and they will give you the answers. You will get an answer for many of the questions. But you may not be convinced because you know that it is slightly different. Because I see so many diabetic patients who have been for 25 years diabetics, not even one microaneurysm in the retina, in either of the eye. But they have been diabetics hopelessly controlled for 25 years. Another group controlled very well, huge florid neovascularization. You see both types of patients. Then there is a difference between these two. So this is what you need to identify in a research question. Once you have done that, then you find number of cases. If you have only 10 cases, it becomes case series. It is not a very popular thing. Then if you do have large number study, then you need to control them and do a randomized control trial. Without that, it has no meaning. large number, it's all biased control. So it should be randomized control. Okay? In the randomized, double mass, triple mass, so many things are there which you is going to talk about it today. You're going to talk about clinical masking also in the thing. Yeah. Okay. Anyway, they are going to talk about it. I think I'll stop at that. The IJO is conducting a research methodology course, and welcome Dr. Nayak. And Nayak is an authority on a lot of things in statistics in research. He has conducted a number of research methodology courses, and he will talk about many of the things which are important. Attend IJO research methodology course to clarify many of your thoughts before you start research. Okay, thank you very much.